Dative, integrative and preventive healthcare. The content discussed in this episode is for informative purposes only
and should not be replaced by individualized professional consultations or professional medical advice.
Hey guys, I'm Tasha.
Hey listeners, this is Goonie, and we're here to discuss lifestyle medicine.
Hi everyone, welcome to Dative, the podcast. We are excited to be back today with you. And so today we'd like to speak about something very, very prevalent in our society, which is burnout, and particularly kind of the impact on our physical health and psychological health because of burnout. And for that, we get to speak to Suki Hon, a naturopathic practitioner who's based in Toronto, Canada, who specializes and works a lot with people in this area. So welcome to Dr. the podcast, Suki. We're glad to have you here today.
Thank you so much for having me.
So welcome, Suki. In this culture, the current culture, where we're always wired and connected, burnout have unfortunately become something quite common. And we'd like to bring the definition of what a burnout is. So burnout is a syndrome conceptualized as a resulting form of chronic workplace stress that has not been successfully managed. It is characterized by three dimensions. One is feeling of energy depletion and exhaustion. The second one is increased mental distance from one's job or feeling negativism or cynicism related to one's job. And the last one is reduced professional efficiency.
And to echo that, there was an article that was published in the National Library of Medicine, which highlighted that burnout was a significant predictor of the following physical consequences, which include type 2 diabetes, coronary heart disease, hospitalization due to cardiovascular disorders, musculoskeletal pain, changes in pain experiences, prolonged fatigue, headaches, gastrointestinal issues. I know this is a long list. And on the psychological side, highlights how insomnia, depressive symptoms, and the use of psychotropic and antidepressant medications have been on the rise, and essentially classified that as mortality below the age of 45 years old.
Like, we all know that burnout isn't technically a new phenomenon. Like, it's been going on for many, many years. But the way that our society has advanced has definitely contributed to its prevalence today, especially in the context of work and school. So first and foremost, we are overstimulated as a species right now. So like with all the screens, the noise, the lights, smells, etc., like we are overloaded with all these cues. And these are actually perceived as stressors already to our bodies because our nervous system hasn't adapted properly to how we're living today. But additionally, like what you mentioned, like we do place a lot of heavy emphasis on productivity and like hustling, that we put ourselves in overdrive when we are in the workplace. So we have been conditioned to learn that, our success is relied heavily on, like how much we can get done and earn. So we push ourselves beyond our capacities to get there at the expense of our own health. And of course, the internal pressure that we put on ourselves to do this constantly becomes the issue. And, when we have this mentality, in the end, we start to have these poor work boundaries, and our mental, emotional, physical health is not prioritized, which can lead to a whole slew of other issues, which you have listed. And yeah, it has been a bit more prevalent now because we are talking about it more and we're recognizing it more as an issue that like, oh, hey, when I'm going to work, I'm feeling this way. This isn't actually normal. And we have finally come to accept that isn't supposed to be the way it's supposed to be.
With regards to the exhaustive list that Tasha kind of read through, and you kind of explaining the context in which we might be prevalent to it, or this hyperconnectivity and all these screens. Sometimes it's hard to say that you are in a state of burnout because, so for example, you could have diabetes, or like the resulting factor is that, but then you're like, how did I even get there? And so you as a naturopath, how did you how do you see your patient come through and say, okay, they might be telling you I have XYZ, but the actual reason is you've been through burnout?
And honestly, it really depends on what symptoms they are showing, because it can show
Right.
up in so many different ways. But most patients do recognize burnout when fatigue is their biggest concern. However, burnout is something that kind of sneaks up on you. And by the time you get to that stage, you're already on the more extreme end of the spectrum, because we have already emptied our tanks, so to speak. So of course, the most obvious sign of burnout is feeling tired and drained, regardless of how many hours you do sleep at night. And this is typically what people recognize. But what a lot of people don't realize is that chronic stress can affect literally every other part of our system, including our neurological, musculoskeletal, cardiovascular, immune system, reproductive system, etc. So depending on the individual, they may have different types of accompanying symptoms, such as mood changes, sleep issues, gut issues. They're getting sick more often, hormonal imbalances, reproductive issues, weight changes, like cognitive impairments, and kind of like what you said, like increased risk of heart diseases. So of course, those are kind of like more on the extreme end if we're not addressing it. But you're right, like it does present in so many different ways. So in practice, what I personally do with my patients is that whatever symptoms they are experiencing, I always ask about their stress and how they're coping with it, because there is such a connectivity around that. So kind of addressing that particular area is always key.
Yeah, I think that's a good indicator of telling us how someone who can communicate it can actually express, okay, these are the things I've been experiencing. And then you go like, oh yeah, these are all like the telltale signs of burnout. And so now I know what I can start addressing. But what about people who aren't able to articulate that, right? And maybe on a visual level as well, maybe as a practitioner, when you see someone and they're not able to communicate, is there something that really stands out for you to say like, oh, I think this person is having burnout?
Yeah, so that is a tricky thing if someone isn't really aware that they are burnt out. So again, aside from asking the questions like, hey, like how's your stress, like how would you rate it on a scale of 1 to 10? How are you coping with it? Visually, it's definitely a bit more difficult to tell. But if you have someone where their vitality seems to be a bit dampened, that's kind of when you're like, oh, okay, like you seem a bit drained. Like how's work, how's stress, how's home? And we kind of go from there.
But when you say vitality is dampened, could you kind of elaborate what that means?
Yeah, so essentially when I think of dampened vitality, for lack of a better word, is that the person that I'm seeing, they're not as, I guess, vibrant, or especially if it's someone that I've been seeing, for a while, where I notice like, oh, they're not emoting as much. They are not as energetic. And just the way that they are talking, it doesn't seem like their authentic self, especially if it's a patient that I have been seeing for a while. There's just that change where they just overall seem tired, which again goes back to that big telltale sign of burnout is fatigue. And I'm sure a lot of people who have gone through burnout will understand, like, it does have such a huge impact on our energy levels and how we kind of like go through our days. Like, okay, we just want the day to be over, so like let's get it over with. And with that, the way that they present themselves can be slightly different as well. But of course, that isn't to say that everyone's vitality is dampened when they're burnt out, but that is one way that it can manifest.
Right. And so you mentioned at some point where to sleep, even though they have X amount of hours of sleep, they still feel very fatigued. Could you go more in depth with regards to that comment? Because you're thinking, well, if you have your 8 hours of sleep, then why is it that you can't recover from it?
And that is such a great question, because burnout and even the sleep quality or quantity sometimes can become this vicious cycle. So first and foremost, sleep is only one aspect of trying to replenish our bodies, right? When we're stressed and burnt out, we're depleted in basically every aspect. So you can think of like nutrients, vitamins, minerals, and then the sleep aspect as well. So if we're sleeping a lot, but we're not replenishing or nourishing our bodies the way that it needs to be while we're burnt out, we're still unable to kind of regain all that energy and kind of like refill our tank, right? And another thing is that when we're stressed, our nervous system actually kicks into its sympathetic mode, meaning it's in its fight or flight mode to deal with the stressor, whatever that may be. And when it comes the time to sleep, even though we're trying to tell our bodies to rest, our nervous system has a difficult time switching over to its rest and digest mode, which is the parasympathetic mode, especially when our work, family, personal boundaries become compromised. And that can affect our ability to sleep well. So it can lead to things like insomnia, or just the quality of sleep that we are getting. We may be sleeping for 10 hours, but if we don't have good quality sleep, then we're not restoring our bodies the way it needs to be restored. And, on a hormonal level, the melatonin that we release, which is our main sleep hormone, can also get disrupted during stress, right? So typically cortisol rises and falls throughout the day. But when we're chronically stressed, cortisol regulation kind of gets disrupted, and we don't get the usual pattern that we want. And without the proper pattern, we don't get the proper release of melatonin, meaning our bodies kind of get confused to when it's actually nighttime, right? And on top of that, there's so many different aspects. When we're stressed, we also tend to stay indoors, overwork, like we don't take care of our well-being as much, which again depletes our tank. But also when we do that and we're indoors exposed to all the screens, artificial lighting, and things like that, that also doesn't help with our internal clock, which then again confuses our bodies to whether or not it's daytime or nighttime. And then again, going back to the sleep quality, that gets affected. And then the restoration piece also gets affected.
That's a very good breakdown of how kind of the cycle can really eat into each other. And so Suki, you've been covering kind of like the physical representations of what burnout looks like. What about the mental health side of things?
That's a great question, especially because it does impact our well-being so much. So with burnout, typically what we see is a loss of motivation. They have a higher risk of experiencing anxiety and depression, lower tolerance towards others. So people can be more irritable, less patient. There may be withdrawal from friends, family, things like that. Sense of self-doubt is always going to be there. More pessimistic outlook. And again, neglecting their own needs. So kind of putting their health and self-care practice in the back burner. So of course, it's not to say, they will experience all of these things, but with burnout, the risk of experiencing those are definitely higher.
Right.
Even in the workplace, because according to definitions, etc., like burnout is linked to the workplace. And I think these are good ways to recognize when someone is going through that, because when your colleague is sometimes potentially, going through or is reaching a burnout stage might be demonstrating these aspects, which is like sometimes because we are all working from home, it's difficult to see the physical side, and we're not there, we're not at home, we don't know if they're taking pills or how they're eating, etc. And so, but the more mental health side is, these are good indication for us to rely on, to recognize when some people are going through that, and just saying, reach out to them and be like, are you okay? And sometimes we can open up a good conversation and potentially help them. But have you experienced when you label that as burnout, does it help people or does it completely reject it?
I have yet to have someone reject that concept in terms of the contributing factor for what they may be experiencing. Usually it's like, oh yeah, no, that makes sense. Especially like you said, when that emotional and mental component is present, because it's so obvious, it has such a huge impact. Whereas if someone only presents themselves with more physical symptoms, they may not link that together yet until I explain that cycle. And then they're like, oh, okay, yeah, let's address our stress because it is making these things worse. A lot of times when people present with physical symptoms, they're like, oh, like everyone experiences these things. Like, so it's pretty normal, right? But in the end, it's like, actually, no, we shouldn't be experiencing these things. So let's address the root cause of it. And if stress is one of them, then we, of course, address that.
The reason why I'm saying that there's possibly people who might reject it is because of this hustle culture, right? They might say, well, I'm all good anyways. Even if I was going through something like that, I can't, afford to even think that way. I can't stop, I can't get rest. And so they already automatically say, no, this is not something that is happening. Because I'm wondering if there might be some people who might actually reject the diagnosis of being burned out.
And I can totally see that because of how our society is. We value hustling and productivity and like multitasking and always on the go. So I can definitely see that. But at least for the patients that I am seeing in practice who are seeking this sort of help, typically they are more receptive.
They put a step forward of saying, I'm here to get help. I've noticed that something's going wrong. But I'm thinking of my surrounding and the people I know from the BAM community. When you talk about burnout, people just say, yeah, you just need to have a bit of good sleep, drink some water, and he'll be fine. He or she will be fine. Do you think that there's a link or prevalence between the BAM community and burnout?
I actually love this question because we don't think about this enough. So short answer, absolutely. Because now we are actually going beyond burnout in terms of, just career and schooling in its own context. Like, of course, those still come into play across all ethnic groups, but now we are factoring in the challenges, POC or marginalized groups are experiencing as contributing factors towards our stress and burnout. Like given what has happened in the past few years, more so in North America with the BLM movement, the anti-Asian hate crimes, even the Israeli-Palestinian conflict, the discoveries of Indigenous children from former residential schools, specifically more in Canada, and everything else that is going on, it is a lot for us to handle. So the mental and emotional toll that it has, even like hearing these traumatic news is quite painful, and of course like very, very draining. And beyond that, there's all the background things that happen, like micro or macro aggressions, racial inequality, discrimination, oppression, and the effects that those have on our well-being on an individual and systemic level. Like that also plays a huge role. And specifically, even as you mentioned, like in the workplace, we, as POC and marginalized groups, like we do experience work a bit differently. We do have to work harder to, like get or, receive what maybe our white counterparts need to do. Right. So
yeah, the relationship with work is so complex. The background of like, I need to show up for work in my best self, because if I don't, then a whole set of people will have to, deal with the stigma that comes with, your ethnic background. And so you have to fight the stereotype, because if you don't, then a whole generation behind will be sacrificed because of that. But that's also coming internally, like it's a culture that has been nurtured within, but the environment has not helped undo these stereotypes, I guess.
Yeah, even thinking as much as, like the immigration population, where they've moved to different areas for a better life, they may be giving up, say, a medical degree back at home to become something else, just so they can give their kids better opportunities. And with that, they have to work harder. They're working at jobs with lower pay, meaning that they may have to take on multiple careers or jobs to pay the bills. And that can be very, very tough on that individual. And with that, it's like, okay, they don't even have time to think about burnout because they need to feed their families first. So there's so much that ties into it, but you're absolutely right. Like POC or BAM community, we do have other factors that contribute to our burnout and stress, just because there are a little bit more of those extra things that kind of take away from our tank that, other more privileged populations may not have to deal with.
Yeah. And in your practice, right, do you see many people from the BAM community coming to get help and showing up for the assistance?
I do see a good percentage, although I will say with naturopathic services, I do understand that, it is out of pocket. It's not covered under our OHIP. So unless they have insurance, it can get a little expensive. So I know that can be a potential barrier. And that's why I do offer affordable rates. But that I do understand that may be a reason why I'm not seeing as many as I would like, but I do see the BAM community as well.
Yeah, just in my own like research for the podcast and stuff, I think a lot of people from the BAM community who are practitioners in the complementary space or even just general health practitioners, you can see that they take much more initiative to create a space where they are more accessible to other people in the community versus people who are more privileged. And so to go back to where we were, from what we've been talking about, how burnout kind of comes about. So from a naturopathic perspective, what would you say are the ways to address and deal with these symptoms?
So naturopathically, we always go back to basics, especially because burnout is like a state of depletion. So we want to replenish and nourish. So think nutrition, good quality sleep, and supplementation to help rebuild our system. Of course, we always have to talk about coping strategies and provide different stress management tools that resonate for that particular individual and that's doable for that individual, and really emphasize on slowing down and kind of just plant the seed where, like hustle culture isn't the only thing that exists here. And it is okay to slow down, it's okay to take a breath. Because at the end of the day, we are not on this earth to just work and pay rent. We're here to live, right? So just kind of planting that seed, be like, hey, you know what? It's okay to slow down. And at least that will give them that first step to accept the fact that burnout shouldn't be the norm. So that's kind of like the key thing there.
And so because you work using a lot of acupuncture, acupressure points, is there a reason why you gravitate more to acupuncture, acupressure for your patients?
Yes. So I grew up in a traditional Chinese household, so I've been exposed to traditional Chinese medicine ever since I was young. But I love working with acupuncture because patients can actually feel the immediate effects, like right after a session or even for the day, the next day. So acupuncture typically strives to rebalance our energies and ensure that the energies are flowing smoothly throughout our entire bodies. And if things are stuck or there is an imbalance, that is when symptoms come up. So in addition to working on the foundational things, which is the nutrition piece, the restorative sleep, which depending on the state they're in, it does take longer to feel its effects. Whereas I love incorporating acupuncture for the more immediate benefit. So they can actually feel some of, the calming benefits and just the restorative benefits around there, just so we can tie the longer and the shorter term benefits together.
That makes sense. And what would be practical tips people can adopt to avoid burnout? Because I think that when you do reach a state of burnout, which we need to put a disclaimer here, is a really severe state of mental health issue, and I think that you need to seek out for help regardless, right? What are some tips you would give to people to prevent getting to that state?
So always taking a step back and scheduling time for yourself is key. Practicing self-care in the form that works for you to replenish that energy tank, essentially. And of course, self-care doesn't have to be expensive or take up a lot of time, like going on vacation or going to a spa. You can make it out to whatever you want it to be. So some great examples can include things like deep belly breathing, which helps you switch from a fight or flight mode to a rest and digest mode. You can spend time in nature, whether this is simply going on a walk to the park or even in your backyard. Connecting with Mother Nature can actually reduce your cortisol levels. And coming up with a wind down routine is always one of my favorites, especially when we're working from home. So this can be post-work or even pre-bedtime routine where you can put your screens away, tidy up, do some stretches, just signaling to your body that it is time to rest and leave work or your to-do list behind.
Yeah, these are great, very implementable tips. I don't even know if that's a word, but that we can take away right now. I think I've definitely used all of those at some point last year during lockdown. So I can vouch for them. And Suki, like before we close off our conversation, do you have like a message to our listeners who are typically like people just like us, the BAM community? And so listening to this conversation, if they are in a state of burnout or they're not even sure how to start and where to go, what would you want them to take action on, and what would you say to them?
Mm-hmm. Yeah, and I think that is very true. Even just like looking at my parents, they're always like, okay, I'm just this strong person, I can take on everything. And my message is that, like, it's okay to not be this superhuman. It's okay to just simply be human, right? It's okay to ask for help. We don't have to take everything on ourselves. And asking for help has so many benefits to our mental well-being, right? It connects us with other people socially, and even looking at the evolution of human beings, like connection is part of our survival. So, asking for help is okay. We are not doing this alone. We are a community and we are here to support each other. And I think that's extremely important to know, especially during times where you feel a little more on the alone side.
Thank you for that, Suki. So to do our closing and our rapid fire questions.
So Suki, what is the first sign that you recognize when you're out of balance?
Personally, for me, I do become less patient towards others, and I do get cravings for specific junk food. So typically my chocolates, and some chips.
You and I both.
Mhm.
And I guess to counter that, what would be your method of getting back into balance?
Yeah, so I try to schedule either a day off or block off a time slot in my day just to not do anything work related specifically. And I know that isn't possible for everyone, but that is the perk personally for myself for working for myself. And yeah, I may go on a walk, I may read, make myself a latte, I may journal, whatever my body is craving or wanting at that particular moment, I do, but nothing work related.
Cool. And since you mentioned books, so talking about books, what is one book that impacted your approach to well-being and wellness?
So actually, I just finished the book called The Art of Nonconformity. And that's just top of mind because we are talking about changing our mindset and our relationship with work. And I think that's a great book in highlighting those shifts and that there are different ways of living life and how we pursue careers. So I think that's a good book to explore.
Yes, rethinking your relationships with work is definitely one. So I'll be reading that book. Thank you.
Well, thank you so much, Suki, for sharing your insight and giving us your perspective on how to navigate burnout and stress. And we are grateful to have you on our show.
You're very welcome. It was a pleasure being on this podcast, and thanks for having me.
If you enjoyed this episode, go ahead and select that follow or subscribe button. For now, stay safe and we'll see you next week.